Good evening, everyone. My name is Allison Holcomb. My pronouns are she and her, and I'm the political director for the ACLU of Washington. I am terribly excited to welcome you to the inaugural event in a series of virtual conversations moderated by award-winning broadcast journalist Enrique Cerna, entitled Pandemics, COVID-19, Racism, and the Call to Action. This series will explore the racial disparities and inequities in Washington's public health and policing systems that are highlighted by COVID-19 and the Black Lives Matter movement. Lawmakers are beginning to convene to prepare for the 2021 state legislative session when these issues and the budget will be top priorities. This series is intended to help keep the focus on equity and the opportunity for deep transformation of how Washington delivers health and safety to its communities. Tonight, ACLU of Washington is joined by the following co-hosting organizations in welcoming you to the conversation: Casa Latina, Centro Latino, El Centro de la Raza, Highline Heritage Museum, Latino Civic Alliance, the Museum of History and Industry, or MOHI, Northwest Immigrant Rights Project, Planned Parenthood Votes Northwest and Hawaii, the Seattle Channel, the Washington State Commission on Hispanic Affairs, and Upstream USA. We join you this evening from the occupied territory of the Coast Salish and Yakama people. We remember that Indigenous people were lied to, treaties were broken, and their land was stolen. We recognize this to honor our truth and our commitment to fighting for justice for all. Acknowledgement is a critical and necessary step toward honoring Native communities and having a larger conversation on decolonization and reconciliation. Thank you for joining us. I'll now turn the microphone over to Enrique and our special guests, whom he will introduce.
Thank you, Allison. Hello and welcome all. Thank you so much for joining us this evening for what I think is an important conversation about the COVID-19 pandemic and also racial disparities that have revealed themselves as we have been dealing with this pandemic. Now, according to data from the CDC, the Centers for Disease Control, COVID-19 has resulted in a disproportionate burden of illness and death within communities of color throughout the United States. Now, here in Washington State, African Americans, Latinos, and Native Americans and Pacific Islanders are experiencing significantly higher rates of COVID-19 cases, deaths, and hospitalizations than whites. Why is this the case? What are the disparities that we're talking about? What's being done to reach out to communities of color? What are the challenges? Those are just some of the questions that we're going to take up this evening with our panel, and let me introduce them now. Very pleased to have joining us this evening, Dr. John Wiesman. He is the Washington State Secretary of Health. Welcome, Dr. Wiesman. Good to have you here. Thank you for joining us. Appreciate it.
Thanks for having me, and I really appreciate the ACLU and all the co-hosts for hosting this conversation, this important conversation tonight.
Also joining us is Dr. Julian Perez of SeaMar Community Health Centers. He heads up their COVID response. Thank you very much, Doctor, for being with us.
Thank you, Enrique. It's a pleasure also to be here with ACLU. I'm a huge fan.
And with us as well, Emily Washines, a Yakima Nation tribal member and a scholar. Emily, thank you so much for joining us. We appreciate it.
Absolutely. Thanks for having me.
All right. And Carlos Olivares, he is the CEO of the Yakima Valley Farm Workers Clinic. He's been in that position a long time, 39 years. Is that right, Carlos?
That's correct.
All right. Well, obviously you're doing a great job over there, so thank you so much. Dr. Wiesman, let me begin with you. When we talk about racial disparities, and particularly as we talk about COVID, how severe and what's the challenge that we have?
Well, thanks. The challenges are great and the disparities are really severe. If we look at, as you said, the cases, for example, of COVID in Washington State, we know that Hispanics and Native Hawaiian and other Pacific Islanders have rates 7 times that of whites in terms of just the pure number of cases that we have. And Blacks are 3 times, and Native American, Alaska Natives about 2.5 times. So just in cases, we see this great disparity. And that continues when we look at hospitalizations. For hospitalizations, Native Hawaiians and other Pacific Islanders are about 13 times as more likely to be hospitalized than whites, and Hispanics about 8 times, and Blacks and American Indian and Alaskan Natives about 3.5 times. So we continue to see these disparities. And with deaths, the disparities aren't as large as the others, but they're still incredibly not great. In terms of the Native Hawaiian and other Pacific Islanders, they're 6 times as likely to experience death from COVID than whites. And Hispanics about 4 times as well as American Indian and Alaskan Natives. So we see with COVID the very same kind of large disparities that we see with many other health issues, which is extremely unfortunate.
And really, we're talking about something that was there as far as disparities even before COVID hit. It's just that COVID now has, put the microscope or the spotlight, I guess, more than anything else.
Absolutely. I mean, we continue to see the current and the persistent sort of system inequities that we experience in general life here. The access to health information has large disparities, access to health information or to services as well. And we continue to see this. We see higher comorbidities in persons of color and indigenous people. And whether, and especially with COVID, where we know people who have diabetes, heart disease kinds of issues experience COVID in a greater proportion. And then if you have those and don't have great access to healthcare in the first place, so that you can't manage and maintain your health in these chronic diseases, it just adds to the disease burden already. So this is really a very severe problem and one that frankly has to get us not only thinking about COVID, but going to the much larger issues around the systemic sort of racism and inequities that we experience in our policies and our systems, and we have to dismantle those.
Dr. Perez, if you can talk a bit about what you see on the front lines there at SeaMar and related to all of this.
Thanks, Enrique. And I think Dr. Wiesman really hit the nail on the head. For years, I worked with colleagues to try and bring this fact to light that the color of your skin and the zip code that you live in largely determines your health in this country. And that's not the situation in a lot of places in the world. So in our clinic, I'll give you a little snapshot of who we serve and what we do. We are essentially from the Canadian border to the Oregon border, and from the Cascade Mountains to the ocean. That's our area along the I-5 corridor. We care for urban and rural migrant workers. And we were founded almost 40 years ago with the Mexican migrant worker in mind. But we've evolved so much. I can count 40 languages among the patients that we care for in King County. And so they come to us with a number of barriers to care, and as well as assets that they bring with them. Chronic diseases like obesity, high blood pressure, high cholesterol, diabetes are rampant. Seeing a normal cholesterol in my clinic is a rare day, a rare celebration. And the way that our patients have always remediated this fact of life is that they've got protective factors, and family being the main one. Common language among their paisanos, among the people that come from Latin America. They stay close to one another. They can reach out to neighbors and trusted advocates when they need help. It's very rare that we see a patient who when I ask them, do you have someone you can call in an emergency? Very rare to have somebody say, no, I have nobody. But we see that quite a bit in our homeless white population of American citizen homeless folks. So clearly there's some assets that have always served our patients well. And what COVID has done is laid bare that that disparity in rights, in worker protections, and in the things that give most of us good health, like a high education, good income, health insurance. And so what we saw beginning in March, when this pandemic began, was that we didn't know what it looked like. We didn't know clinically. I could not tell if someone sitting in front of me had COVID. I couldn't tell it apart from the influenza. And unfortunately, it hit the nursing homes pretty hard, and we had a pretty high death rate. Most of our families don't have families in the nursing home. When a Latino man or woman gets old, they stay home and they're cared for by their children and their grandchildren. So that was a protective factor initially. But as time goes on, and this virus has made its way out into the community, into the rural area, those 3 or 4 generation households has become a detriment to the health, because that virus makes it in through a child that's been to school, or through a farm worker, or a hotel custodian that's brought it home, and now everybody's got it. And some of the younger kids may not even show symptoms until it's too late. Now the adults are coughing. And I've talked with patients who have lost a mother, father, and a grandparent all in 1 week. It's very tragic. And so that protective factor, having multi-generation families to watch your children, a home-cooked meal every night you come home from work, and go to church every Sunday and worship, those are gone. We can't go to church anymore. We can't gather anymore. We can't make those visits to people's houses anymore without risking our health and the health of our friends and family. And so this has been a huge hit to our community. I just have one other thing, that as this pandemic has evolved, we have leveraged the 3 things that we have at our disposal at the clinic. One is our mission. You'll hear from Carlos Olivares pretty soon. That mission is to serve people no matter who or what is going on in their lives. They come to our door, we're going to help. And we have leaders that are faithful to that. Second is our infrastructure. We have over 100 brick and mortar sites, and that has allowed us to coordinate and collaborate with public health and to do community testing. And the third is the trust that the people have in us. We've worked hard to earn that trust over 40 years, and that has allowed us to stay open and to serve the people.
Let me move now to really the other side of the mountains and the Yakima Valley. Emily, I want to bring you in first and talk about what you see and how COVID has affected the Yakima Nation and in your community. I would think that some of the things that Dr. Perez mentioned are really what you're seeing and living.
Yeah, I mean, it's very interesting to me to see how community orientated our peoples are, both within the tribe and maybe in some other ethnicities, meaning we like to gather in small gatherings. You know, we like to celebrate things like birthdays and things together. And so putting these different conditions on really surprises a lot of them. And, you know, we see, unfortunately, the impacts of those smaller gatherings and not being sure and not being certain on our families. We have, you know, I know about 12 people that have passed away. A couple of my uncles have passed from coronavirus, as well as elders that I was very close to, my teacher. And, you know, we have at least about over 30 in the Yakima Nation now. Historically, we know there was at least over 42 that spanned a year. So we're only 6 months in and we're seeing over 30, and we know that it had a really high percentage then. So yeah, there's this part of me that's consistently like, what's going to happen? Who should I be aware of now that it's impacting? I mean, I drive by in the neighborhood here and there's a for sale sign on a house, and that person that lived there died of coronavirus. This changes neighborhoods here. Both, obviously the reservation is checkerboard, so we have a good amount of different ethnicities that are here, and it's changing our communities. It's changing our tribe.
Carlos, so what are you seeing? I would take it that your clinics have many of the same clientele or clients that come to, like SeaMar with Dr. Perez, agricultural, although maybe not all of those are at SeaMar. But what are you experiencing in your clinics?
Yeah, I think pretty much as Dr. Perez has described, the sort of the conditions in which our patients are faced, and certainly the lack of consistent and continuous care has caused the same sort of results that you're seeing described by Dr. Perez. I do agree also that the protective factor that he spoke about as families has, in some ways, has been detrimental for our communities. But my interest in this conversation really is about something that Dr. Wiesman brought up a little earlier, which was there are some systemic issues that have impacted us in a way that without COVID, I think we were aware of, but we were not sort of this there was no clarity as there is today. So I'll give you an example of what I mean about that. As we begin to discuss the questions of how do we manage our populations, and as you know, Yakima was a very large sort of group of people. We were testing at about sometimes as much as 25 to 30% positivity coming back. So we were a pretty hot spot at one point. So there was a tremendous amount of energy and effort, rightfully so, in trying to contain that. Health department was terrific. Department of Health helped quite a bit to help us try to get these conditions in place. However, at the beginning of this, what was absent from those conversations and discussions was the question about what happens to migrant farm workers. What happens to the H-2-1 visa workers coming? How do we isolate? Where do they live? How do we transport these folks from one place of staying to their work? And once they tested positive, where do we isolate them? Right? These folks are living in hotels, they're living in large places where they convene, therefore isolation was very difficult. It was imperative for us to begin to see how do we respond to that. And in one hand, we started early on trying to communicate with the farming community to talk. I put together meetings to talk about how do you want to cope with this. Unfortunately, we got very little response from there. Then immediately, of course, we went to the Department of Health and we began to see the response that was needed. We needed a task force that put together the regulations and the structure by which we would be governed and begin to talk about farm workers and what was important, what was needed. My sort of observations at the beginning of that, because I was pretty upset about the whole sort of no thinking around that. And I said, if this was Boeing, we would have had a policy yesterday. But essential workers like farm workers took a tremendous amount of effort, and thank God for people like Dr. Wiesman and the Department of Health who quickly recognized, yes, there is something that needs to be done. But at the end of the day, it is that systemic sort of absent policy that keeps us in a place where it is difficult to cope with some of these issues. That is why our advocacy, and as I heard Dr. Perez talk about, our leadership in the Hispanic community cannot at any given time for any given reason divert from its mission and its structure that we have today. And we need young people to continue to line up to do this work, because without it, it's going to take a while for this to change in a meaningful way. So today, Yakima is doing better. We've got some very structural testing that's taking place in the warehouses, in the farming communities, but you still have to understand that there is a tremendous amount of resistance among some of the owners, the growers, and the packing folks that are very difficult to sort of overcome. The rules are making it a lot easier to enforce things that normally are difficult to enforce. But I think that this was an incredibly wake-up call to deal not just with the pandemic itself, but to deal with the underlying sort of structural issues that make our communities invisible in so many ways.
Dr. Wiesman, that comes back to that whole, well, the systemic racism that is part of our society, and it doesn't really get the spotlight until something like this happens. And now, okay, had that conversation. I know there were strikes over there to try on the farm workers that were trying to make sure that they were getting the adequate equipment for their health and the work they were doing. But how do you keep this going? Because I mean, the farm working and the harvest, it's a yearly deal and it's important to our economy.
Right. Well, I think, as you've said, this is an ongoing issue, and we have to take this moment, as I think Carlos was saying, and address not only the immediate issues, but look longer term. Look, we know with the emergency rules that we put into place, they were quickly formulated to try and respond to an infectious disease. But you know, we do have other infectious diseases like tuberculosis and other things that do happen, and we can expect at some point again another pandemic. So we have got to take these learnings, figure out what's worked now, what isn't working so well, what additional protections do we need, and pull together the farm worker community and the advocates and the farmers and really say, what are our next steps? Because none of us should rest on sort of just what we've done at this point in time. We've got to learn from this. And, you know, the recent smoke issues with the air quality, once again, just highlighted how we don't have necessarily all the rules in place that we need to have to protect workers who are working outside, whether you're a farm worker, a utility worker, or whatever, and the access that you need to the right equipment in a timely manner. And certainly for some like farm workers, you know, the housing that folks have where workers are providing that is another responsibility that we've got to think through. This, I think, for me is sort of the wake-up call, along with all of the protests that have been occurring, to really say we're at a point in time where we have to capture this in action. There's a public health and healthcare community leaders group advising the governor on COVID, and these are the very conversations that we're having. So this can't be a one and done.
I do want to remind folks that if you have a question for our panelists, go ahead and submit it. It's in the Q&A box. We will work that in there, our conversation. Before I go to Dr. Perez, I want to go back to Emily. And Emily, I'm curious, where is the tribe and the Yakima Nation and all of this? I mean, having grown up in the valley, in Yakima Valley in a way, it often seems that particularly in some of these issues, that the tribe gets lost in all of this. Do you feel that way? Are their voices heard?
I mean, I feel that way sometimes, and I have to really pay attention to like my tweets.
You're one of them, huh?
Yeah, when you see mostly the data. So when you are talking about, oh, we have a downward trend going on in Washington, and you see Washington leaders stating that, but you know in Yakima County, it was still going up and it hadn't even flatlined at that point, and especially hadn't flatlined for tribal members. You felt erased from the data. You felt ignored by the Washington state elected officials. I think there's been some work on that. It is difficult within the tribe to know where there's different data sources. So we have tribal members and fishing villages, obviously on both sides of the state, in Oregon and Washington. So then if somebody at a fishing village in Oregon passed away, who counts that data, and how is it, you know, since it's a tribal member, is it counted at the Yakima Nation? I mean, these are questions that people are they're banging their heads up against, it seems like. We also have different data sources from our clinic and our tribe. So that's why there's two different numbers that will come in. And the people that are informing our state leaders, if they don't know that, if they're not telling them that, that's not going to be represented in their tweet where it's like downward trend, yay, gold stars for us, we're on a right pathway. And meanwhile, it's like, I'm just getting alerts for this person in the hospital. I'm getting alerts for this person that has a funeral ceremony. I mean, I'm getting texts right now about a different funeral ceremony that doesn't actually have to do with coronavirus, is a death and natural causes, but it's these emotional type of things that happen. I think I'm not the only person in the tribe that's very emotional about talking about the data and the numbers and the people, because we see, unfortunately, the negative impacts to it. And obviously a lot of people here in the Yakima Valley have felt that we have never fully shut down. So all the different policies, I appreciate what my co-panelist has said earlier about, having policy and having absent policy. If all your policy is geared towards communities that are able to shut down, you have eliminated our community in your protective measures and in your protective policy. And I think I agree with our other panelists that we're seeing more stuff happen. Yeah.
Dr. Wiesman, you want to address anything there?
No, just fully agree with what Emily said, and I think the lack of the essential workforce being able to have the same kind of ability to protect themselves was a challenge from the beginning, including the lack of PPE supplies and other folks to provide what they really needed. So all of these, this was like one crisis on top of another, and they just really magnified each other. And they're predictable, right? They are predictable, which means we've got to change course.
Right. Dr. Perez, you want to weigh in here on more about, you had some graphs that you were going to show us.
I was just looking at some data about the benefit of the social connections that we leverage in our community. And this is a paper that just came out that shows the comparison in mortality between Latino populations and the white counterparts. And we've always been in that 80% to 90% range where we have a benefit. Even notwithstanding the increased morbidities that we suffer in the form of diabetes and high blood pressure and high cholesterol, those protective factors, our social communications, our faith, those things that protect us, they're just not accessible now. And so you see those graphs acutely rise so that we're right on par now with our white counterparts as far as mortality. So that was impressive. That's exactly what we've been seeing in the clinic. When we have patients that come in sick and we're trying to give them their options as far as isolating, they don't want to go to the hotels that public health has offered. They don't want to leave their kids. Our families have kids, and usually it's two parents working. Or it's a dad working and mom's got 2 or 3 children at home, and there's going to be a grandparent in the house. And so when we start to go into all the complexities of trying to protect one another and figuring out how many bedrooms do you have, how many bathrooms do you have a basement, can you stay with a friend, can you pitch a tent outside? I mean, we really start to get really creative. And most of the time our patients choose to stay home. They want to be close to their family. And this speaks to the other pandemic in this country, which is a lack of trust. Our people of color, especially our immigrant populations who have been pursued and persecuted for so many years now, families separated, even under the most progressive administrations, Obama, Clinton. And now, kids in cages on the border, this stuff is not lost on our families. They don't trust anybody. They trust themselves, they trust their families. That's really what it boils down to. They would rather stay together and take the risk than have somebody go to a hotel and, God forbid, Immigration Customs Enforcement comes and picks them up and they're gone and the mother never finds out about it. This runs through the heads of our patients constantly. And it's really hard to control an infectious disease in those types of conditions. So we have had to find ways to communicate with our patients that is accessible to them, doesn't put them out, on a limb to learn something new. We've made use of our radio stations. We have 2 radio stations that we own and operate. One is 1360 AM El Rey, based out of Seattle, out of our clinic. And the other is in Granger, and out on the east side. And so I'm on the radio every day, giving updates to people, giving announcements in Spanish. We take questions from the community, trying to dispel the myths. At the beginning, it was amazing how many crazy things people believed, like putting a dryer up your nose would kill the virus, all kinds of crazy things that we see on Facebook coming out of Mexico. And we had to dispel all these myths. And it was a lot of that being on the radio. I always say that, you want to get trust in the community, you show up, right? It's FaceTime. That's how you get trust in a community. Well, not being able to have people come to the clinic so much, it was radio time. So we've been on the radio every single day. We do an hour on Wednesdays. And a lot of those broadcasts are recorded and they're rebroadcast nationwide in Spanish. Any radio station in the country that wants to pick these up and use them can do that. And it's been pretty effective. We do use social media a bit, Facebook, and then we also partner with friends in the community like Univision, Jaime Mendez, and a couple other people there. We've done communications like that. But I guess that's been the most challenging part for all of us in primary care, is that a huge part of what we do is educating the community and giving them the capacity to care for themselves. And it's been hard to do that because we don't have translated materials. We don't have bilingual staff at the public health level who can do the contact tracing. And so we've had to volunteer some of our people to help do that. We do a decent amount of that ourselves at the point of care, which is a big part why when we do these community testing clinics, that we have licensed independent practitioners doing this. It's not just a nurse or a medical assistant making those appointments and taking those swabs. It's doctors and ARMPs doing that, because we can ask those very important questions to find out, where did you get this? And then we start to call phone numbers and we report that to King County and to the state of Washington Department of Health. Right. So I think our numbers internally reflect that the work we've done has been valuable and effective. Our own patients, we see spikes during those holidays and the celebrations that they go to, and we haven't had something that's been out of control. You know, at the very beginning, yes, we had a pretty hard situation to manage. We had to put our own protocols in place to keep ourselves safe, but we didn't have enough masks and gowns and gloves. We were panicking practically, trying to figure out how we were going to keep ourselves safe and keep the doors open. That's what the CDC wanted us to do. All federally qualified health centers are supposed to keep the doors open and serve the people. And we were one of the few that didn't shut any clinics. We kept going. Aside from dental, had to shut down for just a little while until their own national organizations could find out how to do this safely. But yeah, that graph essentially tells the whole story. COVID has laid bare the social determinants of health and has taken away those protective factors that our patients have always relied on.
Carlos Olivares, Dr. Perez brings up the issue of trust. Can you talk about that a bit, particularly with what you brought up before and the advocacy you would like to see, and I guess what you particularly need maybe from the state of Washington, but also from the farm community?
Yeah, I think that the question of trust certainly has been with us since the beginning. This is a question of families have been, as Dr. Perez indicated earlier, always leery, always worried about what was going to happen to them. The community health centers over the last 40 plus years across the country have developed a sort of a sense of community and trust. We are the place where people come because they trust that we will take care of them and that we really don't care if they are immigrants or not. But the question of trust during this COVID situation really manifested itself when people were being told, don't worry about the fact that you don't have a job as a dishwasher or a hotel maid, et cetera, because after all, you can always go collect unemployment, and that's going to be really good for you. Well, what happens with that is that people, first of all, are fearful of jumping in and collecting anything that's handed out by the government. So many chose not to go that route. Secondly, the most important element that we all seem to have skipped in all of this that happens on a regular basis in our communities is undocumented people are not eligible for unemployment. And so what we had in the Valley is a very large number of people that all of a sudden live from paycheck to paycheck because they're being paid poorly. And secondly, are now without a job, unable to go and get the unemployment that was readily available for other populations, and found themselves in lines for food banks. And we made almost 20 distribution of food centers throughout the Valley because we needed to feed our communities. So I think that consistently we are seeing these kinds of systematic problems that are not always at the forefront of any policy decision. Under normal circumstances, you would expect to see situations like the one I described, and this issue would have been raised right at the beginning, right? What do we do with the undocumented people that are here? How do we create an environment where these folks are also sustained. Eventually, I think the state and the governor said, okay, we're going to dedicate some money to make sure that that happened. But that was months into the pandemic. In the meantime, you have these families that are unable to do anything. And the abuse that happens when they're renting a home and they know they're not going to do anything when they kicked out of that home cause even greater problems. We run a community action program in our Toppenish facility where we provide rental assistance or emergency lodging assistance. That number of people in a month triple the number of folks that we had in a whole year. So we saw the impact up front close when it came to this systematic sort of inability of policy decision making to have those kinds of things at the forefront of the conversation rather than an afterthought in the conversation.
Yeah.
And so people are leery and they have a hard time trusting institutions that they know are leaving them behind or are not even thinking about them when they're making decisions. And the families in that protective factor that Dr. Perez speaks about so much is indeed the truth. It is indeed the only place where families feel comfortable and they are willing to take the risks, whatever they may be, in order to do this. We've seen families, complete families, lose mom, dad, grandparents because of this. And there's nothing you could do to convince people differently to make that happen. So systemic change is what we should be looking and advocating for. I am done with Band-Aid approaches to these responses that we have. We need to have them. We need to have them today. There's no question about that. But that should not be the end result of what we want and what we need. We too have to find a way to ensure that the institutions that govern our communities are clearly aware of the questions that need to be asked and begin to formulate policy in response to those legitimate questions that, by the way, in this valley represent the wealth that exists here is on the backs of these folks that are not counted for, yet they consistently are called essential workers, right? You've got to be there because you're an essential worker, but nothing else is thought about them at the beginning of this. So I'm hoping we're learning that, in that we're going to move in a direction, like Dr. Wiesman is saying, that we need institutional change that will move our people at the forefront of the problems and in the solutions, as I hope we will see in the future.
Dr. Perez, you wanted to add something?
I do. Something really important. This is at the fundamental, solutions level. When we're talking about getting systems that work for people and value labor, they value human beings. It's got to have a political portion to that solution. And I spoke with some of the representatives at the state level on the Latino caucus, Rebecca Saldaña, who's a senator, and Javier Valdez, who's a representative. And they said that they were speaking with, I believe, Dr. Wiesman, correct me if I'm wrong, making this aware that there need to be better protections for the workers out east. And I think 20 different growers were offered free testing, however much you need, just get your people tested and make sure that it's safe to work. 19 of them declined. Only one accepted that offer. And I believe there was an article in the newspaper about that, celebrating that person's choice. And he said that was a good move because they could guarantee people's safety and they were able to, get that crop harvested and it was good for his farm and good for his operations. But imagine 19 out of 20 didn't want to test. And I asked her why not. She said they didn't want to know. They had too much work to do. They didn't want to take a risk of the fruit rotting on the trees. And what was surprising to me is she said the workers didn't want to be tested either. They didn't want to know. They just wanted to show up and work and get paid and move on. Fascinating. Dr. Wiesman, can you comment on that a little bit more?
Yeah, I don't actually know about the specific data you're referring to, but this goes to the systemic challenges we've had. from the very beginning, we didn't have adequate tests or testing capabilities and supplies. So when we could have sort of gotten on top of this early, we didn't have the resources to be able to do the kind of screening that some would have liked. And I do know some, farmer owners who wanted that, asked for the resource, and the resource wasn't there at the time. And so, again, this sort of how we've been behind, I think, nationally in national strategies as well, has been challenging in the resources, whether it's the PPE or the testing collection kits in the beginning or the adequate reagents to do the tests. It's a constantly moving target. And we have to take, I think, what we've learned here now and say, what do we do differently? What can we do differently now and certainly next season? Because this is not going to go away by spring when we're in the next harvest.
Right. Emily, do you want to weigh in on this? Particularly, I guess, this issue of trusts and institutions?
Well, I mean, what we saw, I'll speak to the point about not wanting to be tested, or there's this taboo in communities sometimes. We saw that in tribal communities. I actually interviewed the people that were first going public with having a positive coronavirus test, both in Yakima tribe and in Colville tribe. They video blogged it themselves, and then I interviewed them to show this broader message, because there was a lot of sentiment, feeling, emotion that was carried with them, guilt, uncertainty. And I think that we see that in our communities. We don't know how do we deal with this? How do we talk about this? How do we, there's no parenting book that says in a pandemic, this is how you talk to your kids about it. There's no, I can't pick up a magazine or something and said, this is how you alert people that you have coronavirus. I mean, I had an exposure risk very early in March, or a concern. I shouldn't say exposure risk. We had a concern, and there was somebody close to me that was tested, and we had to wait. And people, when I was trying to alert others that I was close to, and this is some at a state institution, they were just like, don't say anything. We don't have policies even right now about how to address that. You haven't been on campus, so just wait and see. So I think that sentiment is the pulse of a lot of our communities. We're not certain about so many things, that the lack of clarity on how do I tell somebody that I could have exposed them an accident when I went to go pick up milk, when I went to go pick up this corn or something like that. How do I have that conversation, and the guilt that is carried with that? How do our communities address that?
I want to work in some questions that we've received. One asked this: as an educator, how do we help the students with the trauma being experienced in their communities, and help to improve the remote classroom environment so that BIPOC students feel and know that they are valuable, respected, and accepted? I would imagine that, this is it's so confusing for young students right now as far as dealing with just the issues of online learning and all of that. Dr. Perez, can you maybe pick up on that, particularly what you might be hearing from parents and their kids?
Emily brings up a very good point of taboos. More than probably a half dozen times, I've had radio callers and people asking me the question, can you get infected again? And I thought, very simple, well, it was like one or two cases that I'm aware of in the literature where someone goes infected again. Next question. But no, what they're getting at is, if I was infected, can I make somebody else sick even though I've been declared healthy? Because my friends and family and neighbors don't trust me. They don't come around to see me anymore. Effectively, I have been isolated. I'm in a box now, and no one wants to be my friend. And that is like death for our community, being an outcast, essentially. And so now you take that person who's so isolated and so depressed, and you shut them up in their home with their kids. They have to manage their kids' anxiety The kids often reflect the parents' anxiety, and we see it all the time in the clinic. I had one woman came in and she had been to the ER with a horrible headache, and they thought maybe it was a migraine. I asked her, where did it hurt? And she pointed to her chest. It hurt here, doctor. I said, what did it feel like? She said, panic, just panic. And we talked about it a little bit, and I told her, well, let me work on your neck. And so I just started to give her a little bit of massage on her neck and work on some of the vertebrae, and she just burst into tears. And I said, what's wrong? And she said, no one has touched me physically for 9 months. She had not had human touch for 9 months except for her children, and essentially that was in a mothering role. So just tremendous amount of stress that our people are shouldering. And I'm a highly educated person. I don't know how to teach my kid. I mean, I'm at home 2.5 days a week trying to figure out how to do Microsoft whatever. I don't know the names of these software. I mean, imagine our Spanish speaking patients. Now I think tonight there's actually a 2-hour online training that's free through a community organization trying to help Spanish speaking parents just learn how to teach their kids at home. So this is gigantic responsibilities and an awful lot of stress, and the kids will reflect that. That's what I've seen in the clinic.
Carlos, what are you hearing, particularly dealing with stress and the mental health issues in your community over there?
Yeah, the interesting that this topic is coming up, and that, as you know, we all had to be shut down for a period of time, just like Julian Perez, the dental program had to be shut down for a little bit. We too did not close any of our clinics at any given time. We were testing. We did over 7,000 tests in our community in partnership with the health departments. But at the same time, we were still seeing patients. 26% of our visits were being done video conferencing. However, the interesting statistic that was perhaps surprising and not so surprising at the same time was that our behavioral health systems, either via phone or in telemedicine, were at 140% of their targeted productivity. And so they were inundated by patients who just wanted to have a conversation about either being isolated, about fearful, about all of these things began to surface. And thank God that people, as I said before, trusted our systems, that they could pick up the phone and still make the calls and still talk to their patients. But we are seeing, kids that normally would never hear from, whose parents are trying to figure out, why is my kid depressed? Why is he not running around like the rest of the kids are? Or why is it that my teenager is having so much trouble with this disconnect of not being with his friends or with his family? And fear is the other factor that has surfaced as one of the largest diagnoses that we've seen in behavioral health, which is unusual for some of those conversations to take place in that way for children that young in their age. So we will continue to see this, right? And it is amazing to me how resilient our communities have been over the years, but this thing was completely different. This surfaced things that normally communities like ours would suppress and not talk about it. However, with this pandemic and all of that was put together in one big swoop, communities and people and households and children reacted in a way that we have never seen it before. We employ over 150 behavioral health folks in our system. We're a licensed mental health facility. And for them to be at 140% of productivity was completely unexpected. People were working 14, 16 hours a day to ensure that they were taking the calls, that they were talking to our patients when they needed. They opened the doors for people to come. PPE was essential in that process to protect our workers and to protect our patients as well. And so it's been a real interesting and challenging time, but behavioral health isn't going to go away. If anything, this again highlights the tremendous sort of holes that we have in the system that are not addressing this type of conditions.
Dr. Wiesman, so I know that there's a lot of talk about lack of national direction on dealing with this whole issue of COVID-19, which, goes down to everything else we're talking about right now. What do you need? And then I guess I'd also like to know from Carlos and Dr. Perez and to Emily as well. I mean, what do you need from Dr. Wiesman and the state and the legislature to as we go into a next session here after the first of the year? Start with you, Dr. Wiesman.
Sure. So I think one of the things we need at the national level is clearly a national strategy and a clear message. We can't have these messages of one day you should wear a mask, one day you shouldn't. It's totally confusing. It's creating additional division where it doesn't need to be. Testing strategy. We don't have a national testing strategy. Tests are being developed, new tests are being developed, which is great. Tests that, someday can be done in your home, much like a pregnancy test. We have to have a strategy for those that we are all understanding what the benefit of this test is, where it is best used, and how do we deploy that in a systematic way across this country where it isn't sort of, oh, here are a bunch of, here are millions of new tests for you. You figure out how to use them and what's best. But we sent them to you yesterday. That is what is actually happening like right now, and that is not helpful. So we need this sort of more national, clear strategy. We need to listen to the data and the science and adjust as we go. We do not know everything about COVID. This is a new disease, and we have to be humble enough to say what it is we think we know, what it is we don't know, and indeed, modify our course as appropriate. And I just want to, shout out to my colleagues who are on the panel with me for the great work that they and their organizations are doing. We at the Department of Health really believe that the best way to address these is to fund community organizations that are community rooted, community led, know the community, are from the culture, linguistically appropriate, and who are trusted by the community. And we as government need to keep doing a better job of funding those organizations. When it comes to policy and the legislature, I think we have to look at the budget upcoming, and we have to say, we cannot balance the budget on the backs of the people that it always gets balanced on, whether it's those with mental health issues, behavioral health issues, low income persons. We can't continue to do that. And we're going to have to find solutions that are not an all cuts budget, that recognize the disparities that are out there. Much like, we talk about the undocumented community, for example. It took us a long time to get resources, as Carlos noted, to do wage replacement for people who fell through the cracks. We've always allowed and said it's okay for those people to fall through the cracks. That isn't okay. As Carlos said, we say these are essential workers, but we don't treat them that way. And we have to have our policies looking at the inequities and what we are creating and furthering in terms of discrimination. And so when the legislature meets, when they look at budget, they've got to keep these in mind. And when they look at policies, they have to ask who is being hurt by these and who does not benefit, and then rethink the policy.
Carlos, what do you want from the legislature? Besides
I think Dr. Wiesman is sort of pointing to the most critical pieces that we need is we need to have a legitimate discussion about policy that impacts the minority communities in our state. We need to ensure that if you look at the proposed cuts for this upcoming fiscal year budgets, by far, disproportionately, the people who will be impacted by those cuts are going to be people of color, low-income people who are probably the ones that could support the least those kinds of cuts in our society today. And then lastly, I do think that we need more people of color represented in the legislature, because I think our voices have not historically been at the table, if you will. Most of us have to scream up that table to try to see if they could hear us, and hope to God that we get a sympathetic ear that would understand our dilemma. But we don't elect people that will be the voice of this of our communities. So budget issues need to be considered. We need to have a legitimate conversation on policy, particularly when it comes to farm workers. This pandemic has raised issues that were sort of under the table for a very long time, and we knew they were there, but we just did not have sort of the absolute certainty, as we have after COVID, of some of those systemic problems that we have. So I think we need some real leadership in the legislative here. As far as national is concerned, all I could say is, for crying out loud, please go out and vote so that we can actually have a national policy at some point, because we're going to need it. This isn't going away, and if we are not smart enough to figure this out, we're all going to be in some serious problems down the road.
Emily.
Well, I mean, my co-panelists have covered this really well, but I think the biggest question that we can always kind of do in terms of assessment is to ask if the data is inclusive, right? It's the whole title of this presentation. Is this data inclusive? Do I have all the information? What don't I know? And I think it's very uncomfortable for elected leaders to try to give a status or situation report and to admit that they don't have information from the tribes. But we need to at least be an asterisk on those graphs and say unknown information from this amount of tribes. I mean, with respect to our tribal leadership and how they want to release that information, with respect to our Indian health services, which are federally or tribally run, we need to know what those deaths are. So if you go to Washington State website now and look at the deaths of Native Americans, it's just Native Americans and it says this number. And it's like, which tribe? If I know that 30 of our tribal members have died, and that's close to the number that the state is reporting, does that mean 80% of the people that have died in the state of Washington are Yakama tribal members? You know, and that's still an unanswered question. I've asked different people in the state about that question specifically. And now that I'm with the secretary, I'm going to just put that there. You know, I want to know information. I want to know.
Where are you getting the information, Secretary? Or from the tribes themselves, or is there enough transparency there, or what?
Right. So I think Emily brings up a critical point, which is on our race ethnicity data. We don't have the granularity that anybody wants. We don't have it for our Native Americans. We don't have it for our Asian Pacific Islander folks at the granularity that we need to have it. And we need to keep working on it. You know, as a Board of Health, we recently passed an emergency rule asking for a bunch of granularity on data around race ethnicity. We actually don't have the technology to be able to implement that right now. So we can want to do something that is right to do and is the right policy. Getting it implemented is also a challenge. And with the tribes, you know, part of this is respecting that tribes are sovereign nations, and it's really their data. And we need to coordinate around what it is we think we know and what the tribe knows, and then defer to the tribe in terms of how do those data get presented and the analysis of those. So we're trying to do better work with the epidemiology centers, with the tribal projects in Portland and in Spokane and in Seattle, where they have some of these epidemiologists.
Dr. Perez, as a guy who's on the front line every day, not saying that the others aren't, but particularly in dealing with patients, I guess, what do you need? And what would you like to see happen at the state level?
Two things just at the clinic level. We need enforcement from the most racist grower or rancher or meatpacking manager, all the way to the most well-meaning small business Spanish-speaking owner that's just ignorant to what he or she needs to be doing to keep their clients safe. We need enforcement, because I have not seen enough of that. And if you don't tell people when they're doing something wrong and give them the warning, and then here comes the stick with a fine, or perhaps, follow up with training, it has to be consistent and quick, because there's a lot of people who just skirting the corners and doing whatever they want to do, and because there's nobody coming knocking at the door. That's gotten better, but that was the main thing I was frustrated with at the beginning. Second is PPE. We're down to like level 1 masks now. That's barely enough to keep people safe during a clinic visit. Level 2 and 3 are the ones that really have strong filters and keep a lot of the breath that we exhale out. N95s is not a big deal in the clinic. We don't do that level of care, but just basic stuff like our gowns and those level 2 and 3 masks, we need those. And then I'll just say that the patients say it best. We're on the radio every day, and I called over to Yakima, and we were asking the patients, what's going on over there? The numbers are skyrocketing. And they said, basically, if you like Trump, you don't wear masks. And if you don't like Trump, you will wear a mask. And it was just that clear to them. It is completely along political lines. We have a federal government who really utilizes wonderfully this divide and conquer strategy. They are after immigrant communities to kick us all out. They want to restore this nation to some utopic, greatness that only exists in the minds of white people after World War II. We need this to change. We need a new administration. We need to make sure everybody gets counted. And so the census ends on September 30th. We say it all the time on the radio, tell people, get on the internet and make sure that you're counted, because we're not going to get the resources we need from the feds to fight this epidemic that's not ending tomorrow. It's going to keep going, like Carlos says. And we need people to vote. In this country, we have a lot of Latinos. 50% of the Latinos in this country are eligible to vote. Not all of us are registered. And those that are registered, not everybody votes. And a lot of it's because they just feel like my vote doesn't matter. I don't trust the government. They don't trust me. Why should I participate? It's not going to matter anyway. And that type of a campaign, I think any other government would say this is a democracy. We can agree to disagree, but I respect that bedrock principle of our democracy, that everybody has the right to vote and everybody's vote should count. But you don't see this. You don't see this. Places like Georgia, where we're about to write 100 cards. My family is sending out to Georgia, these people who were disenfranchised. When the governor was elected, he was a secretary of state. He manipulated that office to get in office, and now he's manipulating it again, making people wait in long, long lines at the polls, risking getting infected by COVID. And that only happened in the rural areas. These same people that were in the rural areas, so they went to the suburbs, the white suburbs, and no, people walked right into the polling stations, voted, and came back out. It's hard to say to look at that situation and say that's an accident. And so that is a big part. The trust and the faithfulness to the principles of this nation, that is a must. We need to restore that.
I want to ask one quick question. Have we made progress on the whole thing about wearing a mask, other than, we know that some people aren't, some people from their political stance? I know in the Valley, in the Yakima area, there was a big challenge, and then there was an effort there that turned it around. But are people now, do you feel like there's progress made on that? Dr. Wiesman?
Yes, I would say that there definitely has. Certainly in the businesses and places that we've sort of mandated that, there has. Where I think we're not making the progress we need, it's the wearing the face coverings in those social interactions where you are, with extended family and you're having that barbecue or that birthday party, that's where we're seeing a lot of transmission occurring. And it's the not keeping the physical distance, it's the not wearing face coverings. And for whatever reason, when we translate that to our sort of personal social lives, it's not translating. And we really need that to happen. And we need people keeping those gatherings really small. And, going back to the conversation about, the patient who hadn't been touched for, many, many months, this is a hard time. We need to stay socially connected, and we need to do that in really safe ways. So yes, progress on masks, but we're letting our guard down in our sort of more personal, social relations.
I know it's a hard time, and I know people want to be together, and I know that they, you know, in my community, like to get together, have a good meal, dance, all those types of things. But common sense is we have to implore that, and right now that's very critical. Right, doctors?
I
Okay.
couldn't agree more. Dr. Wiesman
All right.
hit the nail on the
Listen,
head.
I want to thank all of you for taking the time to be a part of this conversation tonight, which I found really good. And I really appreciate the issues and the concerns that you brought out from your respective areas of expertise. Thank you so much, and for joining us, and thank you for taking up my invitation. You're like herding cats, but I got you together. So thank you very much. All right. I do want to say this. Also, I want to thank our community members for this conversation as well. Casa Latina, Centro Latino, El Centro de la Raza, Highline Heritage Museum, Latino Civic Alliance, Northwest Immigrant Rights Project, Planned Parenthood, and also Planned Parenthood Votes Northwest, and Hawaii, the Seattle channel, which is going to broadcast this at a later time, Washington State Commission on Hispanic Affairs, and Upstream, as well as MoHi. Thank you all, and we want to remind folks that this will also the recording of this will be on YouTube at a later time. Hope to send a link out about that, and also I think at a later time through ACLU as well. And I'll leave you with this one last thing, since we did bring it up, and I meant to have my face mask here. You might be able to see this, maybe not. Oops, here. Let me see if I can get that over. So I'm going to leave you with that last thought, folks. All right. Thank you all. We appreciate it very much. Stay safe, wash your hands, wear your mask, and good night, everybody.